Okay, everyone, for today's discussion, we are going to tackle about the hemolytic anemia. So hemolytic anemia is still part of the hypersensitivity reaction or response, specifically your type 2 hypersensitivity reaction. So hemolytic anemia, from the word itself, it's more on anemia, wherein there is decreased level of red blood cell in the blood, which is about less than 3.5 cubic millimeter, okay? Because the normal value of your RBC in the blood is your 3.5 to 5.5 million per cubic millimeter. So if it's below that, that is considered as erythrocytosis, or commonly known as your anemia. So from the word itself, hemo means blood, lytic means lysis. Basically, this is the destruction of the blood, hence leading to your anemia. So this condition is caused by the destruction or hemolysis of RBCs at a rate that exceeds the production. So exceeds production. Why? Because the lifespan of red blood cell is 3 months. So after 3 months, the young blood cells after 3 months will then be die and will go to your spleen for which is considered as the graveyard of dead or distracted RBCs. So basically, anemia occurs when the destruction occurs less than 3 months, which is the normal lifespan of a red blood cell. So what are the common causes of your hemolytic anemia? Okay, these are the etiologic causes that may be related, okay, or that can lead into hemolytic anemia. Number one is inheriting genetic conditions that cause anemia. So basically, this is a genetic cause. There are instances wherein namamana po ang isang, or you're going to inherit a certain condition from your parents, and these are your hemophilia, your hemolytic anemias. Okay, example of these are your sickle cell anemia, thalassemia, and your G6PD, which are all examples of inherited types of anemia. Another one is certain infections. There are instances wherein you get infected by a virus or a bacteria, then you develop an infection, and the infection would actually leads into the destruction of your RBC. Okay. Another one is your certain medications, like for example, if you have cancer and you are under treatment of chemotherapy, so chemotherapeutic drugs attacks now the young blood cells or the fast-growing cells, and these fast-growing cells includes now your blood cells. These blood cells will later on be destroyed by the chemotherapeutic drugs, same as those other cells in the body that is considered as fast-growing. So that is an example of just certain medications. Now, for the types of hemolytic anemia, we actually have your inherited anemia and your acquired anemia. From the word itself, inherited anemia is an anemia, okay, wherein one or more of the genes that control red blood cells production are faulty, meaning there is an inherited problem in terms of the red blood cell production. And this condition can lead now to problems with the hemoglobin. Okay, hemoglobin, which is the oxygen carrier or oxygen carrier of the blood, the cell membrane, or the enzymes that maintain healthy blood cells. Example of this condition, your inherited hemolytic anemia, are your sickle cell anemia, thalassemia, and your G6PD, or your glucose 6-phosphate dehydrogenase deficiency. Okay, so let's go on this one by one. Let's start with thalassemia. Thalassemia is a type of inherited hemolytic anemia wherein the blood or this disorder in which the body doesn't make enough of certain types of hemoglobin. So this is basically lacking of hemoglobin. As we already know, hemoglobin is actually the oxygen carrier of the blood, which also makes the blood color red. This condition causes the body now to make fewer healthy red blood cells than normal, okay, and it is common to Southeast Asian and Indian, Chinese, Filipino, Mediterranean, and African origin of descent. Okay, the other one is your glucose 6-phosphate dehydrogenase or your G6PD deficiency. Your G6PD deficiency is wherein your red blood cells are missing an important enzyme called G6PD. This enzyme is very important for the normal chemistry inside the red blood cells. So without your G6PD, your blood will going to destruct. Okay, so in G6PD deficiency, if red blood cells come into contact with certain substance in the bloodstream, the missing enzyme causes now the cells to rupture or burst and die. So basically, if you lack this G6PD, it will now be missing the enzyme that maintains now the homeostasis within the red blood cell. So without your G6PD, or if there is a deficiency on this one, red blood cell that will be formulated from the bone marrow will be then destructed or will burst and eventually die, leading now to your anemia. So the factors that can trigger this breakdown of the red blood cells are the following. Number one, if you take sulfa or anti-malarial medicines. So basically, if you are positive with G6PD, which is one of the conditions that can be assessed during newborn screening, okay, you will be forever needs to avoid these following factors. Number one is that you are not allowed to take anti-malarial drugs. It is considered to be your not allergen, but it is considered to be contraindicated to your condition. Okay, so if you have G6PD, anti-malarial medications such as your quinine and chloroquine is not allowed to be administered to you. Another one is being exposed to naphthalines. If you're actually familiar, naphthalene or your naphthalene balls are actually those white marble-like materials that we actually put or place in the drawer to prevent them from being destroyed by, or our clothes to being destroyed by cockroach. Okay, so naphthalene balls. Okay, what else? You're eating fava beans. If you're eating fava beans, that can also be contraindicated. And having an infection is another contraindicated. Okay. Aside from that, there are actually a list of food that you will have to prevent or avoid if you have G6PD. Kasama or included, especially in the practice of Filipino, is your bitter gourd or your ampalaya. Because your ampalaya or bitter gourd actually has a substance that now contributes to the destruction of your RBC. Okay, with patient that has G6PD deficiency. Okay, the next one is it mostly affects now African and Mediterranean descent. Okay, the last one under your inherited hemolytic anemia is your sickle cell anemia. So sickle cell anemia is a serious condition that is inherited or genetic by nature, wherein the body makes an abnormal hemoglobin, causes now the red blood cells to become sickled or will become a crescent shape. So basically, it looks like a crescent moon. So if you know what a crescent moon is, the shape is actually para siyang letter C. It looks like the letter C. The problem with this condition is that since there is an abnormal shape of the red blood cell, there is a possibility that it will be stopped, okay, on capillaries or small blood vessels that would later on occlude this area and will prevent a blood to flow in the needed specific area. Like for example, it can happen in your peripheral arteries. Like for example, in my hands, in my feet. So if a certain capillary there, okay, got stuck with this crescent shape red blood cells, it's definitely going to affect the circulation of this patient. Now, in terms of your sickle cell anemia, the intervention is actually based on the mnemonics HOPIA. So HOPIA, H-O-P-I-A. So H-O-P-I-A, H means hydration. So to this patient, we have to manage them through hydration because we have to make the blood more non-viscous or diluted so that these blood cells will also be freely flowing inside our blood vessel. Okay? Another one is oxygenation. We have to give oxygen to this patient because there is already a problem with oxygenation. And take note that this patient has a problem with the red blood cells, which has hemoglobin, which is considered to be the oxygen carrier of the blood. Letter P stands for pain. Since a possible occlusion may occur in the peripheral areas, this occlusion will eventually lead to necrosis and eventually the experience, or the patient may experience pain, actually severe pain. That is why with patient who has sickle cell anemia, especially to children, we really have to watch out for pain symptoms such as an increase in your respiratory and cardiac rate, manifestations such as diaphoresis, and of course, facial expressions and guarding behavior. Now, if the patient is in pain, then we need to manage the patient who is in pain. If there is a medical order or a medication order to manage the pain, then we just need to give it to our patient together with other independent nursing interventions. Another one is I is infection. Our blood contains now the nutrients that prevents the body or that protects the body and fight infection. So if we have a problem with the circulation, because the blood that is supposed to be helping in the transport of blood-rich oxygen, or the oxygen-rich blood and nutrient-rich blood into other body parts of our body, including now the immunoglobulins. So we're gonna have a problem because if the occlusion occurs in different areas of the body, the patient will become at risk also to develop infection, because the IgG or immunoglobulins will not be able to make it and go to areas that will not protect the body. Okay? And the last one is altitude. To patient with sickle cell anemia, it is very important that we should not be letting them to go to areas that has high altitude. Why? Because the higher the altitude, the lesser or the thinner the oxygen available. Okay? The thinner the oxygen available for the human body to consume. Therefore, for patient with sickle cell anemia who already has a problem with oxygenation, it is not ideal for them to go to high places or places with high altitude. So I can still remember in the board in the book, or in the NCLEX book, that the examples that they gave in the NCLEX book for your exams, or for international exams, that the example of place that they've mentioned there is the Yellowstone Park. Okay, Yellowstone Park in the United States. Pero kapag Pilipinas, or if it is in Baguio, if it's in the Philippines, probably the best example for this high altitude area is Baguio City. Okay, so that is HOPIA for the management of sickle cell anemia. So sickle cells don't last as long as healthy red blood cells. So they usually die after only about 10 to 20 days, and the bone marrow can't make new red blood cells that are fast enough to replace the dying ones. As we already know, the lifespan of red blood cells in the body is a period of at least 3 months. So if the blood cells will die for about 10 to 20 days, well, definitely the body will not be able to cope up with the production of new blood cells. Hence, the patient will become anemic. And since the anemia is due to the sickling, okay, or due to the problem in the shapes and in the structure of the red blood cell, that is why we call this condition as your sickle cell anemia, and is common to African American descent. Okay, I hope that is clear with your sickle cell anemia. So aside from the inherited anemia, we also have your acquired hemolytic anemia. Acquired hemolytic anemia, okay, has also different examples. Number one here is your immune hemolytic anemia. So immune hemolytic anemia is the immune system destroys now your red blood cell. So among all the types, this is actually the one that is mostly or the most related into our topic, which is your hypersensitivity reaction. So basically, this type of anemia is an autoimmune anemia, wherein our own immune system tries now to destroy the blood cells that we have. The three main types of this condition is your autoimmune, alloimmune, and your drug-induced hemolytic anemia. Okay, drug-induced hemolytic anemia. Let's go and discuss it one by one. Number one is your autoimmune hemolytic anemia, or your AIHA, under your immune hemolytic anemia. So AIHA, or autoimmune hemolytic anemia, as it says in the slide, this is a condition wherein the immune system makes antibodies or proteins that attack your red blood cells. So AIHA accounts for half of all cases of all hemolytic anemia. Okay, so lahat po ng accounted cases na meron tayo, more than half of it were actually due to autoimmune hemolytic anemia. So what is the etiologic factor of this condition? How does it occur? So etiologic factor includes your chronic lymphocytic leukemia. So if you have a problem with your white blood cells, another one, your non-Hodgkin's, Hodgkin's lymphoma and other blood cancers, if you have cancer, your Epstein-Barr virus infection, and your cytomegalovirus infection, plus your mycoplasma pneumonia infection, and with patient with hepatitis and HIV infection. So basically, if you have these following conditions, you are very prone, or you are high risk of developing autoimmune hemolytic anemia. Okay, so if you want to hear more about discussions on hepatitis and HIV, kindly check our channel for other videos. Okay, and after you have a blood and marrow stem cell transplant, immune hemolytic anemia can also occur. And if I'm not mistaken, from previous videos, we were able to discuss already your blood and marrow stem cell transplant. So your blood incompatibility is an example of an autoimmune hemolytic anemia. So yung blood compatibility na discussions natin. Okay, for the autoimmune hemolytic anemia, the antibodies made by the body are called warm antibodies. This means they are active, that is, they destroy red blood cells at warm temperature, such as body temperature. While in other types naman, AIHA, the body makes cold reactive antibodies, and these antibodies are active at cold in temperature and will now become active when parts of the body, such as the hands or feet, are exposed to temperatures lower than 32 to 50 degrees Fahrenheit, or 0 to 10 degrees Celsius. So, but among the two, your warm and cold antibodies, okay, during autoimmune hemolytic anemia, most common po ang ating warm bodies or warm antibodies, because humans are considered to be warm-blooded. Okay? Unless you are living in countries that are snowing for all throughout the year, or sobrang lamig, like the Alaska, Finland, and some countries in the North and the South Pole, kung meron man nakatira, okay, that could be you being predisposed to cold reactive antibodies. Okay? Warm antibody or AIHA is more common than cold antibody, as I have mentioned earlier. Now, aside from your autoimmune, we also have your alloimmune hemolytic anemia. Alloimmune hemolytic anemia occurs if your body makes antibodies against red blood cells that you get from blood transfusion. Kanina, blood transplant and your bone marrow transplant, alloimmune hemolytic anemia is more specific through your blood transfusion reaction. It happens if the transfused blood is different from blood type that your blood. So, blood typing natin, so the universal donor is your O, the universal recipient is your AB. O can donate to everyone, but O cannot receive blood to anyone. A can donate to A and AB, while B can donate to B and AB. But B cannot donate to A, and same goes with your A cannot donate with B. But AB cannot donate to everyone, but he can receive blood to every types of blood. Okay? So that sounds unfair to blood type O, and that sounds selfish naman po sa ating mga blood type A's. So if you're going to transfuse now blood that are not compatible to this patient, most probably the patient will suffer from alloimmune hemolytic anemia. So this can occur during pregnancy also if a woman has Rh negative blood and her baby has Rh positive blood, or also known as your Rh incompatibility, wherein during the first pregnancy, the baby who has an Rh positive, her blood or his blood will now be mixed with the blood of the mother, who is mostly Rh negative. So this will now create your antibody resistance immune response. Then definitely succeeding pregnancies will be terminated, okay, or will be terminated because of your Rh incompatibility condition. Next, Rh factor is a protein on red blood cell which can either be a positive or a negative factor. Okay. The last one is your drug-induced hemolytic anemia. Drug-induced hemolytic anemia are wherein a certain medications can cause a reaction that develops into hemolytic anemia, such as these medications. Penicillin bind to red blood cell surfaces and can cause antibodies to develop. That is why most antibiotics, before giving it to the patient, it requires to have a skin test to determine if the patient, okay, has an immune response against these drugs that will be introduced into the body. Okay, so it's very important for us nurses to determine reactions that may occur before administering drugs such as your antibiotics, specifically your penicillin, because it can cause now your hemolytic anemia, which eventually in severe condition can kill the patient. So other medicines that can cause hemolytic anemia in other ways, examples are your chemotherapy drugs, just like I've mentioned earlier, acetaminophen, quinine, which is anti-malarial drugs, okay, anti-inflammatory medicines, and your levodopa. So levodopa is the drug of choice to patient who has Parkinson's disease. Okay, so this basically is a drug that will increase the dopamine level of the patient, which is low to patient suffering from Parkinson's disease. Aside from the immune hemolytic anemia, we also have your mechanical hemolytic anemia. So your mechanical hemolytic anemia is still under the types of your acquired hemolytic anemia together with your immune hemolytic anemia. So your mechanical hemolytic anemia, wherein physical damage to red blood cells membranes can cause them to break down faster than normal due to the following reason. Number one, a change in the small blood vessels, an artificial heart valve, or other device used in blood vessels. Hemodialysis can also cause anemia. Okay, that is why post-hemodialysis, the patient needs to be injected subcutaneously with a synthetic hormone produced by, which is originally produced by the kidney, the hormone erythropoietin. So the synthetic hormone of erythropoietin is known as your epoetin. So post-hemodialysis, the patient needs to be injected with this one to compensate with the lost blood during hemodialysis. Heart-lung bypass machine, which may be used during open heart surgery, okay, same as your hemodialysis, can also lessen the content of red blood cells into our system or in the vascular system, hence may lead to anemia. Preeclampsia or eclampsia, wherein the pregnant woman has a high blood pressure during pregnancy, which follows by eclampsia, okay, which is a serious condition that causes seizures in pregnant women. Malignant hypertension can also cause this condition. This condition in which your blood pressure suddenly and rapidly rises, causing now breakdown in your red blood cells. Thrombotic thrombocytopenic purpura, which is a condition that affects now your platelets or your thrombocytes, which is responsible for clotting of the blood. So if there is a problem, okay, or thrombocytopenia, your thrombocytes decreases in number, which is below 150,000, okay, per cubic millimeter. So if your thrombocyte or platelet goes down now to below 150,000, the patient will now be having problems with clotting. Hence, the problem will be more on bleeding tendencies. So if a person bleeds, take note that if a person bleeds, there is a decreased amount of blood. Hence, the patient will be diagnosed with anemia as well. Okay? Blood cell damage also may occur in the limbs as a result of doing strenuous activities, such as taking part in marathons, so which may lead to destruction of your blood cells. And the last one is still under your acquired hemolytic anemia, together with your immune and mechanical, is your paroxysmal nocturnal hemoglobinuria. So this is a disorder in which the red blood cells are faulty due to lack of a certain protein. The body destroys these cells more quickly than normal, and people who have PNH or paroxysmal nocturnal hemoglobinuria at increased risk for blood clots in the veins and low levels of white blood cells and platelets. So those are the three types of your acquired hemolytic anemia. Okay, but the most related type of hemolytic anemia under our discussion for hypersensitivity reaction is your immune, okay, your immune hemolytic anemia, to include your autoimmune condition, okay, drug-induced, and your alloimmune. Okay, please review also on your sickle cell anemia, because those are very important types of anemia that usually comes out in the board exam. If you do have any questions, just kindly please comment it down sa ating comment section, and we will try to answer it on our next videos. That would be it. Thank you for watching.